All right, welcome back, everybody, to the next episode of How to Get Away with Staffing. My name is Colin LeBeau, president here at Foxhire, an employer of record platform in the US. And I've got my colleague, Jamie Henry, our director of operations and healthcare services, with me today. Hey, Jamie.
Hey, Colin.
How are you?
Good. How are you?
Good. Doing good. We got a really important question that's affecting the whole country, and also, more specifically for our niche, affecting the staffing market and their clients, which is healthcare facilities. And that question is, why are healthcare workers leaving the workforce? Why are they on the sidelines and not working? What's going on?
Yeah, it's a great question, right? And it's certainly all over the headlines, right? Healthcare workers are burning out, and you'll see it specific to disciplines. Sometimes it's just in general, right? And we know it. We see it. We're still seeing the demand from clients to have roles filled, but there just seems to be a shortage of candidates. Um, and there's certainly been a large number of surveys looking at the issue, right? But the reality is it existed even before the pandemic.
Yeah.
So it's being driven by a number of factors. Well, actually, it's being driven largely by the baby boomers themselves, right? So they're aging out of the workforce. They've spent their time working. They're starting to enjoy retirement. However, with the aging process, they're also increasing the demand for healthcare services. So as we're losing that large group of experienced staff for the healthcare industry, we're seeing increased demand for healthcare services. And so that kind of causes a problem. I mean, we were talking about the pending healthcare workforce shortage long before the pandemic. And since the pandemic, obviously, we have seen that intensify, and it is due to a lot of the stress that those workers are under. Having worked in that environment myself, I can tell you whether you're inpatient, outpatient, remote, it doesn't matter. Caring for human lives is extremely stressful. And we're definitely starting to see the impact and seeing some of those workers look for other opportunities that don't involve necessarily being at the bedside providing patient care.
Interesting. So do you think it's all to do with that population, or at what level do you think the quality of workplace environment or staffing scheduling or work-life balance is affecting this whole thing?
All of those things are affecting it. I mean, you hit the nail on the head, right? It's not any one individual factor that's creating that stress load. And honestly, there's a lot of interplay between those factors as well. So, when
Yeah.
you have difficulty getting workers scheduled, then they're running with higher, worker to patient. I don't want to just say nurse to patient. We see so many of the headlines tied to nursing, but it's more than
Right.
nursing, right?
Yeah.
So, we see those higher worker to patient ratio or patient to worker ratios, and it creates a tremendous amount of stress. It's resulting in, workers not feeling like they can take breaks when they need to. They're working shifts that are well past their scheduled hours, which they're then getting, you know, challenging questions from, their employers because they're all looking at productivity, right? So why were you on an hour past the end of your shift? Well, because they were trying to catch up on charting and all those things they
Their
couldn't do
paperwork.
because they were so busy. That's exactly right. They have difficulty getting days off. There's a lot of working, you know, holidays and weekends and those things that we see as quality time with our families, right? So they're not getting a lot of that downtime. And I think when you haven't worked in that industry, that schedule sounds pretty awesome, right? You're thinking 3 days a week, like that's not tough. But those 3 days that you do work are extremely intense, right?
Brutal.
Sometimes you're not even getting restroom breaks, much less
Yeah.
a lunch break, et cetera. And they also make it really difficult to balance life outside of work. So think about trying to support a family, right? So scheduling just those standard, parent teacher conferences, orthodontist appointments, all those things that we have to balance. And you have fewer days in which to get them accomplished, right? And, calling off if somebody does get sick, or heaven forbid, even if you get sick, oftentimes is challenging
Right.
too, because a lot of times there's point systems in place within those organizations that are meant to try to improve attendance, right? We need our workers at the bedside to care for patients. The patients are there. We can't have the workers not there. But what it leads to is really this sense of stress and almost over dedication on the part of the workers to the employer. And therefore, they're not taking care of themselves. And ultimately, it does lead to those higher levels of burnout.
Mm.
Likewise, because those days are so busy, And they're busy at every level, right? So from your very novice new worker to the field to your managers and your directors and et cetera, who are busy, trying to handle all of those administrative tasks. There's not a lot of time left to do things like mentor and provide professional development opportunities and some of those things that really help to keep our workers engaged and help them to feel supported. So that's also contributing. And then unfortunately, it's a pretty well-known phenomenon that violence in healthcare is higher than other
Yeah.
industries, right? And it's not just what we see in the headlines as far as like, we do see all the shootings at hospitals or, nurses and physicians, et cetera, attacked by patients or family members. But there's also a lot of incivility and bullying that has just been a common part of the healthcare industry. Now I will say, I think in the past decade in particular, there have been a lot of strides to try to address that, but it's still there and it's definitely still a factor. So all those things come together to just kind of create a pretty intense work environment that does take its toll.
Hostile work environment.
Yeah, yeah.
So you mentioned something earlier that I wasn't necessarily familiar with that I want to learn about a little bit here, which was this point system. Can you explain the point system and what that means? Like attendance point system, what is that exactly?
Yeah, so a lot of hospitals, healthcare systems, et cetera, will allow a certain number of absences per employee. And a lot of times, they'll even weight those absences based on, do they fall on an assigned holiday? Do they fall on a weekend? And so they're really looking to target those areas where they know people are more likely to call off because there's certain things that would be enticing that call off, right? So, or you'll get penalized for calling off, say, with less than 2 hours before the start of a shift. Well, as a working mom of three, let me tell you, my children didn't time their fevers for me. And so the number of
Yeah.
times I went to wake somebody up, right before it was time to take them to daycare, you got somebody with a fever and you're stuck because you can't take the kiddo to daycare and now you can't report to work and you've just called off and received, two points towards your attendance because it was
Mm.
not, within that 2 hour time frame. So those are
Got
just
it.
things that make it really challenging.
Yeah, that's tough. I mean, I would understand why people might find their way out of the job if they were punitively being hit. But I understand also from the hospital system's perspective, like how do we manage this whole
That's right.
thing? Like,
That's right. Because obviously they run on really thin margins too, right? So you
yeah,
can't just keep an influx of staff waiting in the wings and, pull from that pool. There's always a certain amount of overscheduling that's done, but there's a dissatisfier there too that you have to be careful with. So if you've overstaffed in anticipation of backfilling those last minute absences, and now all of a sudden you have too many staff on for the day, you have to send people home. And that's not always received well either. So,
right.
people have already paid for their childcare, gotten up, gotten ready, et cetera, and now they're being sent home. And a lot of times, if they want paid for that shift, it then has to come out of their PTO. That's not received well either. So it really is a very
Yeah,
delicate balancing act.
that's tough because they
Yeah,
also have patient nurse patient ratios, patient ratios that they have to meet. So they do have
correct.
to drive some level of accountability when it comes
That's
to
right.
scheduling.
Especially in certain states and in certain environments, right? So we're actually this has long been a standard in acute care, so inpatient hospital areas, especially in certain states like California. But now, with some changes to how long-term care is being managed, we're seeing these changes begin to be mandated across long-term care as well. And so
Yeah,
they're going to also be making similar changes to staffing models to ensure that they're meeting those minimums.
that's gonna be tough because they're on thinner margins than I feel like the hospital systems are on.
Oh, absolutely. Yeah, definitely.
So one of the concepts you're talking about is like we have this shortage of workers because of the population that is going into healthcare services more often are these baby boomers, which is a bigger population than the population that's after them trying to support them, right?
Right.
But also I've been hearing these other terms, which I want to see how true you feel like this is. Some believe that we don't necessarily have a worker shortage, like enough workers. We just have a workers that want to work shortage. How true do you feel like that might be?
Yeah, I do think there's some truth to that. So again, also not necessarily tied to the pandemic. I think it became much more common knowledge during that time. But healthcare in particular has always had a fairly high rate of attrition within that first year. So
Yeah.
again, nursing has tracked these sorts of things longer. And so it's easier to find those statistics for nursing, but certainly this is replicated across other disciplines. It's not unique to nursing. But,
Sure.
the American Nursing Association reports that, you know, 18% of all new grads will leave the nursing profession within their first year. So you have to think, they even if it's an LPN license, they have a minimum of like an 18-month commitment to that license. So they have the time and expense that they've put into that education. And it's not necessarily directly translatable to other areas. So for a lot of nurses, that choice to leave, for a lot of disciplines, that choice to leave is a big deal. But
Right.
it tells you how much they're finding that it's just not a fit for them. So there are certainly a pool of healthcare professionals that are just opting not to work in healthcare anymore. But there's actually a really cool dashboard that I would encourage anybody who is recruiting or supplying any sort of staffing to the healthcare industry to keep an eye on, because it really kind of reflects again how much that shortage is not necessarily related to just workers not willing to work, because they're looking at licensing and other things that tell us who's eligible to work in the field. And that's the I apologize, I am blanking on the name.
No worries.
Let me find it for you though, because it's great. It's something that I always keep saved in my bookmarks. I do look at it on a fairly regular basis, although typically looking once or twice a year is sufficient, because they're looking at a 15-year
Hmm.
timeline. Um, and it's the Healthcare Resources and Services Administration. So the HRSA, they have a healthcare workforce projections dashboard,
Oh,
and it
interesting.
will show you specifically by discipline if you want to drill down that deep, but it'll also just show you like a nice graph overall of kind of what the expected trend is, both in terms of the supply of the current workforce and the anticipated demand for services. So
I
for
assume
workforce
demand's going up and
workers.
supplies going down.
That is exactly right.
Yeah, yeah, yeah.
Yes.
Well, it's interesting you mentioned the decision those nurses are making, right? Because there's other things that are sort of impacting them as well. And so it is really a big decision, because assuming that they went to school, they have some student loans to pay off, and they spent a lot of time in their field of study preparing for this, and then within a year leaving at 20% almost, so 1 in 5,
Right.
that's a pretty interesting statistic.
It is. Yeah. I mean, it's actually kind of startling. And I will say, so I think we really are starting to see healthcare systems take an interest in how do we keep those nurses at the bedside. And so again, a lot of the focus is on nursing. It's in part because they are the largest percentage of the workforce in healthcare,
Sure.
and also just because they have so many strong organizations that have been active for years supporting that segment of the healthcare industry. So
Right.
um, there are some really cool programs around nurse externships, which is where you have students who are they're not working as nurse tech. They're actually working in non-productive roles where the majority of their time is spent shadowing a nurse, and they're being paid to do this. So the hospital is paying these nurses to come in and shadow with this nurse. And so anybody who's actually ever trained anybody professionally knows when you're training, you slow down, right? So that the hospital's making such a commitment to trying to keep these newer nurses on board that they're willing to pay them to come work in a non-productive role, meaning they can't take patient care independently. And they're slowing down their nurses that are caring for those patients to help train these oncoming nurses in hopes that they feel better supported, better prepared, better connected, and will stay at that hospital as a productive nurse when they complete their education. So it's
Well,
yeah, kind of a cool program, right?
big.
Definitely a way of creating those connections and supports from the very beginning. And we're also just seeing in general more nurse internships have been common for a number of years now. So same
Sure.
concept, but it's happening as a new nurse grad comes in and is working at the hospital. So those have been around for a while. We're seeing those expanded upon though, more resources dumped in. And rather than it being something a nurse can volunteer to be a part of, a lot of them are being assigned to be a part of it now. So it's truly, trying to engage and better support from the very beginning.
Interesting. Okay, so we've got health systems wanting to invest to
Mhm.
get nurses to stay and other positions to stay in their roles. One of the sources of that talent are staffing firms. And we hear, oh, big investments in this, but we're seeing a lot of the staffing firm revenues drop. I think AMN's revenue is down like 25%.
Right. And I
They're one
think
of the
cross
biggest
country
healthcare
reported
staffing.
numbers pretty similar. Yeah. So we're seeing
Yeah,
it in multiple
so
areas. Yeah.
that investment is not going to staffing firms right
No.
now.
Yeah.
What's going on with that?
Well, a couple things. So for starters, oftentimes newer nurses are not going to be eligible to fill those types of roles, and for good reason, because they require support, right? So they're not ready to go into those types of roles. And again, I think what we're seeing from some of these healthcare systems is an interest in trying to build and maintain their own talent. So they're trying to decrease their reliance upon agency. So not eliminate. I don't think that's the goal. Nothing that I have seen would tend to support eliminating agency support as a
Yeah,
whole. But they are trying to build better and more creative pipelines. They're trying to invest more in the nurses they do have. They're doing things like creating their own internal float pools that might expand across multiple different campuses. So, it's not just a float pool for a specific campus, it's multiple campuses, it's multiple specialty areas in those campuses, right? So you might take your staff that's critically trained, so trained for critical care, and use them in your burn unit, or post surgical for complex cases, things like that. So there's a lot more flexibility than what we used to have. Likewise, they're going to things like flexible schedule, and even some independent shift swapping and self scheduling and things like
yeah,
that. So this is where we're seeing these healthcare systems invest in their own in an effort to try to expand and maintain and be able to create flexibility from within, right? Um, and I think that's why we're not necessarily seeing a lot of that spend going to other areas, such
yeah.
as
They're
the
looking for
MSPs.
alternative solutions, and I think we've seen some that they've developed, which incorporate some of the things you're talking about with float pools, along with investments or partnerships with like gig platform
Yes,
services to enable a
yes.
self-service, homegrown shift platform experience.
Absolutely. That's right. And so they are starting to, when the gig platforms first kind of emerged, it was not necessarily the big health systems that were using them. Where we saw them coming into play was more of long-term care, but the pandemic did shift that, and we started seeing, even some of the larger healthcare systems using those to help augment
Yeah,
more of those per diem type gaps, right? So the
right,
day-to-day gaps in staffing. So they're not necessarily using them to fill an 8-week maternity leave that they've got 3 months to plan for, right? This is Saturday nights notoriously short. Let's see if we can get some people to pick up, kind of thing. And so we are seeing that for sure. And some of them are even looking to try to replicate that type of technology into their own scheduling software.
right.
We're hearing some very interesting stories. I've listened to a number of really interesting podcasts lately where a lot of the bigger healthcare systems are really working towards trying to get managers 100% out of staffing and scheduling and get all of it into basically the software, and having it be staff driven and be able to use certain algorithms and some predictive modeling to determine what's needed when, and get the staff to fill those themselves, and even build in some of those things that we typically see around like shift differentials and even some bonuses and incentives to get some of those short shifted areas covered.
Right. Yeah, really interesting. So when you say we're making these investments in basically staffing, but it's not going to staffing firms, like where's the money at? It's in a lot of these different areas.
Yeah, yeah. They're trying to build long-term resources they can continue to lean on. But here's the thing. That's not a fit. That's not a fit for every,
Right.
every hospital, every healthcare system. These are going to be your bigger, more sophisticated systems that have the resources to do it. And by resources, I don't just mean the finances. You need to have the IT support as well. You have to have enough administration to be able to implement those things and support your staff through the changes. because it's a big deal, right? And like we just discussed before, you're talking about teams of people whose work days are packed already. They don't have time built into their day to
Yeah.
go, watch a video showing them how to use something new, or attend an in-person session or online session to learn new scheduling software. They're intensely busy, and so you're going to need a lot of resources to support them. So your rural hospitals, your small to mid-sized hospitals and healthcare systems are not necessarily going to be able to build these types of supports that they can lean on. They're not going to be able to even purchase them necessarily. They're still going to look to agencies to help support those things, because the other thing too is, in order for those types of tools to work, you still have to have a big enough talent pool. If the
Right.
talent pool isn't there, it
There's no
doesn't
one to
matter
fill the
how
shifts.
creatively you schedule them. There's limitations, right? So
Yeah.
that's where those agencies are still providing a really valuable service, because they can tap the talent pools and make sure that it's the right fit for what the client needs.
Right. Yeah. So there are effects on staffing, but also on gig platforms, um,
Mhm.
in differing ways. But yeah, it's not a one size fits all. I think, we're seeing a lot of the staffing spend being focused on from a finance level in the bigger organizations that got really, really out of control with spending during the pandemic because they were so overwhelmed. Those CFOs are saying, hey, we need to reduce our contract labor spend. That has been a key topic in almost every single weekly email we get from Becker's and these other different,
Exactly.
healthcare publications. So, but yeah, conversely, I think other industries are adopting staffing more so, to your point, the smaller mid-sized areas. So just for staffing agencies, they need to be able to pivot and supplement some of that income, or find new technological ways to serve their clients, because there are white label solutions that can enable them to deliver similar experiences to their clients that allow
Absolutely.
shift-based
Yep.
self-service work.
Yeah. And I do think we're seeing more and more of that, right? More and more, we're hearing clients say they want their agencies to be able to interact with whatever the software is that they're using, or have their
Right.
own software. We're seeing higher scrutiny on levels of, um, cybersecurity and
Yeah.
a
Cyber
lot of those
insurance.
things. Yep, absolutely. So, I mean, there's no doubt about it. The trends are going to involve technology, whether it's systems implementing them themselves or looking to agencies that will have those types of solutions they can leverage.
Yeah. Are there any success stories that you've heard about, where they've either adopted this like new technology or things like that, that you would recall that might be interesting to talk about?
Yeah. So again, there are so there are a number of success stories. Becker's has a lot of great. You can go back and look through. They have a ton of webinars where they have gone in, interviewed various different healthcare systems that have implemented different, whether they've partnered with gig platforms or their VMS experience, building things internally themselves. There's also a great podcast series called The Handoff, and each session of that podcast is typically interviewing a nurse leader or healthcare leader of some sort and talking about the changes and advancements and things that they're doing. And it's largely focused on staffing. Um, and there are a number of stories, even just in the past 6 months, in their podcast library, that are various different individual healthcare systems that really focus on, um, you know, how to handle the complexity of healthcare staffing positively. And there is no one size fits all. So that's what's really neat too, and what's really unique, I think, about each of the solutions that these various different systems is building. They have some commonalities, but they're not the same. So
Yeah.
it just kind of
They're more
depends on.
bespoke for their situation.
Exactly. Yes.
Interesting. So what do you think the next 5 years looks like? Like, where are we going to? What's going to happen with this whole thing? We have less workers, more people that need work, that need
Yeah.
support. Baby boomers are going to continue to age out. What's going to happen?
Yep. So the next 5 years, we're going to continue to see a shortage, right? This won't be fixed in 5 years. This is actually a problem that we all know gets worse before it gets better. So I think the things to look for and the opportunities to look for, like we said, you've got the aging boomer population. So long-term care, I know it's going through some struggles right now, but it's not going away. It'll rebound and it will continue to grow as most of the most of the analysts seem to be indicating. And just looking at numbers, we would expect that to be the case. But likewise, you're also going to see more boomers looking to age in place. And so home care will continue to increase as well.
Yeah.
This is also a generation that's aging relatively healthy. And so they have a need for care, but that need might look different, right? So we are going to see specialty care for some of those diseases of aging, but we're also going to see a lot of like allied health support because we are now using a lot more technology to support things like PT, OT, speech that will necessitate those allied health providers to be directly involved in caring for the individuals that are benefiting from those technologies. And that'll be in the acute care environment, but also long-term care and even at home. So I think we're going to continue to see demand there. Likewise, we're already seeing a big increase in demand for allied health and even school nursing, in the school environment. And so we anticipate that that's going to continue to be a growing area that will be serviced largely by agencies, most likely. And that's because most schools don't carry the insurance to employ those individuals themselves. So there's a high need in that segment of the market because they can't provide the appropriate support. So they need both the candidates and then also the ability to employ and ensure those candidates appropriately. I think telehealth is huge too. We've already seen that. We saw that spike with the pandemic. It's not going away. The demand is there. So we're going to continue to see a lot in telehealth. And then I also think some of the roles that we don't think of traditionally as healthcare, but they are, right? This is going to be your billing and your coding. So a lot of those like more administrative type roles, even some clinical leadership, we're going to see a need for those to be able to be employed remotely. And again, that's an opportunity for agencies where, perhaps we don't have, hospital systems may not be able to employ a hospital system in Ohio may not be able to employ somebody in Kentucky, but you have opportunity there to be able to support those types of roles. And we are seeing that increasingly. And I think we will continue to even more so over the next 5 years. But as we discussed earlier too, I think that's just the trend and where the jobs are going. I think the trend for supporting those jobs is really obvious, right? It's something we're all aware of, and that's technology. So it's going to come in a number of different formats, but technological advancement is going to help to defray the workload and close some of that
Right.
gap that we have. But it's also going to be a vital part of employing those individuals from, better software for recruiting. We're seeing some increased demand already for better onboarding, things that are easier to interact with. You're talking about a population that often works during the hours where we're traditionally thinking about doing things related to recruiting, onboarding, et cetera. So they need a platform they can interact with on their schedule and remotely, right? So it's going to be technology driven. This is not going to be give me a call, email me your resume type situation anymore. It's definitely moving away from that. And even looking for better options for sharing all of that, personal information that we look for when it comes to doing those onboarding. So
Yep.
people have, right, there's a huge emphasis in healthcare on cybersecurity, and they're looking to even make sure that those practices are conducted in a secure fashion.
Yeah, I'm really excited to see how technology can continue to make this process easier and allow for continued growth in the space. It's going to be an interesting 5 years. I think that there will be an equilibrium reached where, although it is a tough position, these health systems and organizations like ourselves and others will make it as easy as possible for people to take these roles, be fulfilled, and we'll see a sort of leveling out of that trend towards not working in these positions, even if you have the right credentials. So I'm hopeful for that in the future, and I'm hopeful that you guys found this valuable. If you have any questions, feel free to reach out to us. Otherwise, we'll see you on the next episode of How to Get Away with Staffing. Thank you. See you guys later.